right, future doctors, welcome. If the thought of aspergillosis on your exam has you just a little bit worried, well, you are in exactly the right place. In this high-yield explainer, we are going to skip all that textbook fluff and get straight to what you need to know. We're talking core concepts, some killer mnemonics, and those classic spotter images you absolutely have to nail. So let's get right into it.
Okay, so here's our game plan. We're going to tackle this logically, just like you would on an exam. First, we'll meet the fungus itself. Then, we'll dig into how it causes trouble. That's the pathogenesis. After that, we'll cover the actual diseases it causes, how to spot it in the lab, and finally, how we fight back with treatment. You know, this structure isn't just for this explainer, it's the perfect blueprint for your exam answers. So, let's start with the basics. What exactly is aspergillosis? Well, a key point to remember is that it's not just one disease. You gotta think of it more like a spectrum of illnesses. It can range from simple allergic reactions all the way to severe invasive infections, and it's all caused by a mold you've probably already breathed in today, Aspergillus.
Now, there are over 180 species of Aspergillus out there, but for your exams, you really only need to know the big three. These are your main villains: Aspergillus fumigatus, Aspergillus flavus, and Aspergillus niger. Seriously, if you see a question on aspergillosis, chances are one of these is the culprit. So let's just lock these names into your memory right now.
All right, so we've met the key players. Now, how does a fungus that's literally everywhere in our environment get inside our bodies and cause such serious problems? Let's break down the pathogenesis.
It all starts with a single breath. See, Aspergillus absolutely loves decaying stuff, like compost piles and old leaves. And from there, it releases millions of these tiny spores called conidia into the air. They're so small that when we breathe them in, they can travel all the way down into the tiniest airways of our lungs. And that right there is the entry point. Okay, everyone, pay close attention to this slide. This is a classic exam question, and it's designed to trip you up. When you look at Aspergillus under the microscope, you're going to see two key things. The hyphae, which are the fungal threads, are septate. That means they have cross walls. And they branch at a sharp, acute 45-degree angle. This is your V for victory. Don't you dare confuse it with mucor, which has non-septate hyphae and branches at a wide 90-degree angle. Nailing this distinction is an easy way to pick up some serious marks.
Now, Aspergillus is what we call an opportunist. It's a coward. It doesn't really attack healthy people. It waits for the immune system to be weakened. And the #1 risk factor you absolutely must remember is glucocorticoid use. Steroids are a huge vulnerability. After that, you want to think about things that affect our neutrophils, our main fungal fighting cells, like profound neutropenia or neutrophil dysfunction. And finally, any pre-existing lung damage, like from COPD or TB, creates the perfect little home for this fungus to move into.
So we know how it gets in and who's at risk, but what does the disease actually look like in a patient? This is where it gets really interesting, because aspergillosis can wear a whole lot of different hats. As you can see here, the lungs are pretty much ground zero. This is where most of the action happens. It can present as an allergic reaction, called ABPA, or it can form a fungus ball, an Aspergilloma, that just sits inside an old lung cavity. In the most severe cases, it can become invasive, spreading through the lung tissue. But look at the other sites. It's not just the lungs. It can cause invasive sinusitis, spread to the brain, the heart, the eyes, and even cause ear infections. It's a systemic threat.
Okay, now for a massive high-yield point you absolutely cannot forget. Look at this pathway. Our friend Aspergillus flavus, which is often found on crops like corn and peanuts, produces this nasty toxin called aflatoxin. Now, if someone eats food that's been contaminated with this toxin, it acts as a potent carcinogen, and it can directly lead to hepatocellular carcinoma. That's liver cancer. This link is a favorite for examiners, so please burn this into your brain.
Okay, time to put on our lab coats. Acing the theory is one thing, but you also need to know what this looks like in your practicals. So, how do we prove our patient has aspergillosis? Let's get into the lab diagnosis.
This right here, this is a classic spotter slide. If you see this image in a practical exam, the bells for invasive aspergillosis should be ringing loud and clear in your head. I want you to zero in on what you're seeing. Narrow hyphae with clear septa or cross walls. And most importantly, notice that distinctive V-shaped acute angle branching. That's the money shot. That is textbook Aspergillus.
Now, when we grow this fungus in the lab on a culture plate, typically Sebro-dextrose agar or SDA, the different species give us a huge visual clue. They're very characteristic colors. Let's look at how you can tell them apart just by looking at the plate.
Here's a dead simple mnemonic that will make this stick, I promise. For Aspergillus fumigatus, think fuming smoke. It has a smoky green to blue-green color. For Aspergillus flavus, well, flav is just Latin for yellow, so you're looking for a yellowish-green colony. And the easiest one, Aspergillus niger. Niger is Latin for black. It produces these jet black colonies, smoky green, yellow-green, and black. Simple, effective, and totally exam-proof.
So the colony color gets us in the ballpark, but for a definitive ID, we have to go to the microscope. This is where those subtle but crucial differences between the species become crystal clear. Let's take a look at the schematics of their microscopic structures.
Okay, this table is pure gold. Screenshot it, write it down, do whatever works for you. This is your cheat sheet for microscopic ID. Notice that fumigatus is the odd one out with that conical vesicle. The other two are globular. And look at the phyllites. Those are the structures that produce the spores. Fumigatus has just a single row, on the top part only. Flavus and niger have more, but the key is that niger has 2 full rows and its black conidia cover the entire vesicle. Master this table and you will absolutely nail any species identification question they throw at you. So, sometimes we can't get a sample to look at directly, so instead we can look for the fungus's footprints in the patient's blood. The 2 big antigen tests to know are galactomannan, which is highly specific for Aspergillus and is a key test for invasive disease, and then beta-D-glucan, which is more of a general alarm for any invasive fungal infection. And on the other side, we can look for the body's reaction by testing for antibodies like IgE, which will be sky high in allergic forms like ABPA.
Okay, we've found the fungus. We've identified it. So how do we kill it? This is our final section, treatment. And the most important thing to remember here is that one size does not fit all. The treatment depends entirely on the type of disease we're dealing with.
This slide lays it all out for you. You absolutely must match the treatment to the clinical syndrome. For invasive, life-threatening disease, the drug of choice is voriconazole. For the allergic form, ABPA, it's itraconazole. For a single fungus ball, an Aspergilloma, we often don't even use drugs at all. We call on the surgeons to just remove it. And finally, to prevent infection in very high-risk patients, we use prophylaxis with posaconazole. Just know these 4 scenarios.
All right, let's end with a quick pop quiz to lock in one of the most important concepts. What is the single most important microscopic feature that distinguishes Aspergillus from Eucor? Think about the hyphae, think about the branching. If you can answer that, you've mastered one of the most high-yield points of this entire topic. Nail that down and you'll be in great shape for your exams.